it's unfortunate that your business demands of you to use skills that you were never taught. What's really fortunate is that there are many dental consultants and coaches out there that are going to beautifully close that gap for you. Dentists have the humility most of the time to say, I need help with this. And you don't get that from medical doctors. You don't get that in a lot of industries. But in the dental space, I find that unique in a way that I really treasure and value, which is that dentists are willing to say, I need help. I need a coach.
Welcome to another episode of the Irreplaceable Dental Team. Listen, I always have gems, but look at my guest. Look behind her. She's just exuding positivity, all that we need right in this season. And my guest, her first name is very similar to somebody you may have grown up with, but maybe you thought it was a male. This Micky is female. Ladies and gentlemen, boys and girls. I introduce to you my friend, Micky Chorny. Welcome, Micky. How are you doing today?
Oh, first of all, thank you so much for having me and for letting me share with your community today. Yeah. And hi, everyone. I'm Micky. I'm so fine. I blow your mind. Hey, Micky. Right? So it's either Micky like the mouse or yes. I have a theme song, right?
We'll take the theme song.
Yes. And it really is a pleasure to be here. Thank you for having me.
Now, Micky, I recently met you at a dental entrepreneur women's retreat. Mm-hmm. And what you had to say intrigued me so much. I said, I got to get this lady on our podcast. Before we delve in, can you just share a little bit about yourself? Who is Micky? Why is she in this space? You know, what does she have to offer?
Yeah.
Just some information about you.
For sure. So I love telling people about how I got into dentistry because it's very unexpected. Okay. So I have a background in theater. That's what I went to school for. I got a Bachelor of Fine Arts in Drama from NYU Tisch School of the Arts, very prestigious. Yes. And I was very much doing the actor thing in New York City for several years. Okay. And then I stumbled into personal development courses. And I stumbled into like leadership training and coaching development, right? And as I was diving into that, it became really clear to me that there was a career change afoot. Mm-hmm. And right at that same time, there was a friend in one of these programs that I was in who said, hey, I know a dental consulting company that is looking to hire new coaches. Okay. And my first reaction was like, oh, no. Like, I'm not qualified. I've only ever been in a dental chair as a patient. Like, what do I know about dentistry? And so I just kind of let that pass. And then a couple months later, she was like, they're still hiring and I still think you should apply. And I thought, okay. And I took the gamble. And this company that ended up hiring me, it was really cool because what they were looking for was coaches who had like the coaching chops, mm-hmm. who could learn the dental stuff. Okay. And so they hired me into their sales department to start, and I learned everything that I could. I was a sponge. I spent a lot of time with the CEO and with seasoned coaches and watching them do what they do and studying everything they gave me. I'm a very quick learner. And by 6 months in, ooh. I was coaching full time.
Okay.
And I stayed at that company for 7 years, one of their most successful coaches. I've made some amazing relationships with these dentists. I have a special place in my heart for the dental industry now because I know so much about what they deal with now that I have a deep appreciation for what dentists go through just to have a practice.
Right.
You know? And I love getting to make a difference in this way, in a way that's healthcare and service oriented. And so I really fell in love with it. I fell in love with the dental industry. And at the same time, I have a business partner, and she really fell in love with coaching in like other parts of life. So we joined forces and we created our company, for which there is a branch that does dental coaching specifically.
Gotcha.
Yeah.
Yes. So, Micky, I have a quick question for you.
Yeah.
I mean, you've coached thousands across various fields between you and your partner, okay? What are the one or two most common communication breakdowns you see, specifically in the dental practice? And what's the first step to fixing them?
Yeah. So this is kind of a loaded question. I think if you ask me what the doctor's communication breakdowns are, they're very different from the team's breakdowns, right? So the doctors struggle with like, I don't know how many times I got to say this, and the team's not doing it, right? Or I don't know why my culture is so bad. I can't get the team to do or implement things, right? That's usually what doctors are dealing with, aside from the fact that they don't know how to run a business. They've never been taught how to be a CEO, like all the things. But when it comes to communication, it's like, I just can't seem to get my team on the same page with me. Right? And what I often will see from the team is, how am I supposed to do what my doctor asks me when I'm not even seeing them doing it? Right? So how am I supposed to be accountable when my doctor isn't accountable? So this sort of like us and them, like not understanding the view of the other side, therefore judging the other side rather than listening to each other and actually sharing with each other. Like no one's trying to come up with a solution that works for everybody. Everyone's just on a hill they want to die on about how their struggle is the worst struggle and nobody understands. And I would say this is pretty common in most work environments. This isn't like just dentists. This is what most businesses are dealing with. It just has the flavor of dental practice.
Yeah, I think I would have to agree with you 100%, Micky. One of my mentors is John C. Maxwell, and he always says, leadership is simply influence. Okay, no more, no less. And to be able to influence, you have to lead by example. And what I hear you saying is there is need for great improvement as it relates to modeling the behavior you want to see. Is that basically what I heard you saying?
Oh, yeah, for sure.
Yeah.
Yeah. And here's the thing that's always the kicker is like, no one's teaching this in dental school or in the school where you learn anything. Like no profession is teaching this. And it's critical everywhere. Not just in a dental space, in any space.
So I can underscore that and put that exclamation mark and put that dot right there. I got lucky. When I graduated from dental school, I ended up in an office where they had hired a practice management company. So all the void that I left dental school with was quickly filled because that dentist had the mindset to put us in an environment where coaches were bringing to us communication skills, systems, speaking with the doctors, speaking with the team, speaking with the hygienist. So I fully get it. There's a big gap there between being highly skilled as a clinician and learning how to lead, how to manage a practice, how to communicate with your team. Yeah, big gap. So in Jamaica, we would say, Micky, you have a big work.
Yes. And one thing I want to say to the dentists out there that are listening today is it's unfortunate that your business demands of you to use skills that you were never taught. What's really fortunate is that there are many dental consultants and coaches out there that are going to beautifully close that gap for you. Right. But the best coaches coach people who are coachable.
True.
Right. And the coaches are also coachable. So I say that to say, you in the dental industry, we're actually very fortunate that there are lots of resources to close that gap.
Right.
And we're fortunate also, I find that dentists have the humility most of the time to say, I need help with this. And you don't get that from medical doctors. You don't get that in a lot of industries. But in the dental space, I find that unique in a way that I really treasure and value, which is that dentists are willing to say, I need help. I need a coach.
Yeah.
And that's honestly the first step.
I agree with you. Now, I'm going to drill down on a very, very common challenge in dental offices. There's often a little conflict between the front desk and the clinical staff.
Mm-hmm.
What do you think is a practical strategy for resolving these front desk to clinical office tensions?
Yeah. So remember that thing I was saying earlier about the us and them and like people having their view and arguing for that view only? That's 99% of what's happening. Is the people in the front office have their view of the way things are that they believe nobody else understands, and they may be right. And the back office has their view of the way things are and nobody understands them. And they may be right. But the way to solve that is to actually come together and listen. See, we think we're listening, but we are not. We are just looking for our cue to insert what we believe needs to be inserted, which is very different than taking in what someone else is saying. So there's this image, a graphic that shows like two people standing facing each other. And on the floor is what looks like the number 6 or the number 9. Right? And so one of them is arguing like, no, it's definitely the number 9. And the other one's like, no, it's definitely the number 6. But if they just walked around 180 degrees, they could see the world through the other person's eyes. And that's often what I see is missing in that like front back rivalry. It's like, try to put an assistant or a hygienist at the front answering phones for 20 minutes, right? And then they might have a different tune. And, same thing for the front office. Put them chair side for 10, 20 minutes. Obviously we wouldn't have them practice anything clinically because that would be against the law, but have them navigate those spaces for 5, 10 minutes, right? It's not that one is better than the other. It's not that one's struggle is more compelling than the other. It's that they're not willing to see each other's hard.
Yes.
They're too busy arguing for them. Like, people would rather be right than happy.
Right.
Yeah.
That is so true. In many offices, what we do is cross-train. Because, most dental offices are so small that if one person is missing, you feel the void unless somebody is able to fill in, even partially, short term. And I think cross-training is a great way of, as you gave the example of, seeing it from the other person's point of view. And so I believe a front desk person who has had some experience in the clinical area is better able to relate to the clinical staff and vice versa.
Yeah.
I'm a big proponent of cross-training.
Yes. I want to add something to that.
Mm-hmm.
So whenever I train a dental office and I work with the front office, and we're talking about like optimal scheduling, for example, or scheduling to meet production goals, I will be very straight with them. I'll say, you got to sit down with your assistants and your hygienists and ask them what the workflow is like on a very productive day. Are they like trying to come up for air on roller skates, barely getting a lunch, and like frazzled by the end of the day, but like it was a very productive day? Don't give them those days. But you have to ask them, right? And the same thing with a hygienist. Like, how many new patients can you take in a day without totally destroying your energy and your production? Usually it's not more than 1 or 2 per hygienist for a day, right? Depending on how long that visit is. But the point is you got to talk to each other. And when you're booking a patient for treatment, talk to an assistant about where it would go well in a particular day, like in the doctor's workflow. If you're in dialogue about what works for you and what works in your flow, then you can work together towards the common goal. But most of the time, we're not concerning ourselves with that. And that's the major gap for me.
I agree with you. In fact, in many offices, what we do is what we call schedule engineering. We block off certain times that would be high production. Say some offices, they work really well in the morning when they're alert. And so in the afternoon, they want to do light stuff. Mm-hmm. Or some dentists may have a preference to starting off slow in the morning and doing the chunk of the stuff midday and then chilling out the day. But communication is key, as you say, Micky. Understanding what works best for that team and working towards that goal. But unless it's fleshed out, as you've said, it's all up in the air.
And there's so much assumption.
She's just trying to fill the gaps.
Yeah.
They're just trying to make sure that the work is done, but how it comes together can't work well unless we understand each other, we're communicating with each other, and we respect what each other needs to the extent that it can be done for the benefit of the office. So yes, I agree with you 100%. Now, Micky, you have a great line about people getting unstuck around. Can you give us an example of a simple shift a practice leader can make to create a more unstuck and empowered culture?
Yes. So generally, when clients come to me or when I start working with a client, they are stuck somewhere, right? Otherwise, they wouldn't be asking for support. And sometimes the stuckness is more dramatic than others. Sometimes it's like, oh, we're not as efficient as we could be, right? But I've worked with doctors who feel really stuck in like the, let's say, getting everybody on board with like implementing something or even honoring the standard of care. So one of the biggest conversations I have with my clinicians, doctors, assistants, hygienists, is standard of care is not just about your doctor's philosophy. It is about agreeing on what is the evidence that we see on an x-ray or an intraoral photo that indicates this diagnosis versus this diagnosis, and actually agreeing such that every time we see that, we predict that the diagnosis is going to be consistent. And this is especially critical when there's multiple doctors in an office, because you'll have assistants and hygienists who are like, well, depending on the doctor, like I may not say this to the patient because the doctor is going to shoot it down or totally invalidate me, right? So we often see like, you know, it may look like the data may show that case acceptance is not very high or that retention is not very good and your patients are not coming back through hygiene at the rate that we need them to. But what's underneath that in a lot of cases is, well, are we having agreements in place about how we diagnose and how we treatment plan so it's consistent no matter who's talking to the patient? And that's just one of the ways, right? So I've had doctors where this was a big issue, especially because they had multiple doctors in the office. And it's simple, it's not easy, but I said you have to have as many meetings as it takes, as many hours as it takes to go through all of the most common diagnoses that you have in the office and pulling up the ones that are like questionable, like the x-ray showed this and the hygienist wasn't totally sure, and like one doctor would have said this and another doctor would have said that, and you actually got to talk about it in a meeting until you can agree that we're going to err on the side of this versus this. This is what feeds confidence to your assistants and to your hygienists, so they can talk to patients about what they see and prepare the patient for what the doctor is going to diagnose. That is what's going to build the trust and the consistency for a patient to go, oh yeah, the hygienist did say that. Okay, that makes sense. What do I do next? As opposed to, well, the hygienist said this, but now the doctor's saying this. Now I'm kind of confused.
Yes. So what I would summarize what you've said is in this way: CCK, consistency and clarity is key.
Yes, exactly. And one of my favorite quotes is, the single biggest problem with communication is the illusion it has taken place.
Right.
George Bernard Shaw, right?
Yes.
So it's like, you think you've talked about your standard of care, but I will bet money that you have not in the way that I've just described.
Yes.
Yeah.
That is so true. So many things are assumed.
Yeah. And we know what that does, right?
Okay, I'm going to leave that right. So,
Yeah.
Micky, what does the grace of customer service look like when you were dealing with high anxiety or difficult dental patients?
So, again, a lot of the coaching that I give is not dental specific, it's people specific.
Right.
They apply it anywhere. And so I think this often gets used as a throwaway, like compassion and active listening. People say that like buzzwords, like, yeah, you have compassion and active listening, and like that makes a good experience. But I really mean, like, how often are you sitting your patient up in the chair and looking them in the eyes? How often are you hearing what they're saying and letting them know, like, I really get that? And asking, like, what would make it better for you right now? How can I support you? Not just going through the motions automatically, because we take it for granted, right? One of the things that makes people anxious in the dental office is they don't know what's happening or what's going to happen next, and they're worried about what's going to happen, right? Is it going to hurt? Are they going to put a drill in my mouth? You know, all these things, aside from just the discomfort of lying on your back in a very vulnerable position, right? And so we have the curse of knowledge when we're the professionals in the room, because we see it all the time. It's like commonplace for us. So we don't think anything of it, so much so that we start to take for granted that it is not that way for a patient sitting in the chair. They do this twice a year, maybe 4 times if they're in periotherapy, and that's it. So every time they're sitting in that chair, it's a relatively unfamiliar experience, or it's new in some way, right? So I would say that the first step is remind yourself regularly that this is new for them every time. And also, eye contact goes a very long way. Asking questions around what will make them more comfortable goes a very long way. And then the other thing that I think also often gets missed is the way you explain treatment or issues to patients. Your language is too elevated and it goes over their head. That makes them more nervous and more anxious and more confused. So look at how you are explaining things to your patients. Don't use technical terms. Explain it to them like they're 5. You know?
I love what you've said about that, because it's so important. What we take for granted, it's not an automatic for the patient speaking to. And each patient is different, right? So we have to look at their temperance, you know. We have to look at our degree of empathy, as you've said, which basically means putting yourself in that patient's shoes.
Yes.
And once you can do that, it helps you to be more patient, less arrogant. And at the end of the day, it creates a win-win situation. So I love what you've said. Now, what is one often overlooked soft skill that directly and significantly impacts a practice's bottom line?
Ooh, okay. There's many that I could talk about, but I think bottom line is the one that kind of sticks out to me. So when I think of a soft skill that really would impact the bottom line, I think about the way that we greet our patients and the way that we explain treatment to our patients or educate. So I'm going to double down on what I said about explaining like they're a 5-year-old. People buy experiences. They buy how things make them feel more than the logical reason for buying them. And that is especially true around dentistry. And so the ability to give someone a feeling that they matter.
Yes.
And give someone a feeling that they're safe is exponentially more valuable than all of the fancy terminology you give them about their condition.
You are so on point, because I can tell you as a practitioner, I've gone through some difficult things with patients, and because we went through the hard together, they're committed for life.
Yeah.
It had nothing to do. Well, of course, you want to have proper clinical skills, but it's more feeling of, okay, we're going to do this together.
Yeah.
And being honest and open, and at the same time, bringing back your word again, being empathetic, understanding, maybe I need to pause here, I need to rub a shoulder. I need to check, are you okay? I need to have my team recognize the value of treating people, not just fixing teeth. I think I hear us saying the exact same thing. I can't imagine. Folks probably would not believe that we had not had this conversation before, because we're so aligned with seeing the landscape of dentistry, the dental dynamics, especially with our patients. What do you think is the most important thing a leader should do to guide their team through a period of high stress and uncertainty?
Go first. High stress and uncertainty means people are scared. People don't want to make mistakes because they feel like the stakes are high. And so if I mess up, I'm going to ruin something big, right? Or if I say how stressed I actually am, like I'm going to be judged or questioned, like all these things, right? So on a very fundamental level, leadership means you go first. So if you want,
example,
if you want your team to be vulnerable with you, be vulnerable with your team. If you want your team to take risks and, fail forward, make it safe.
Right.
Show them that you make mistakes and fail forward too. Make it okay to not be okay, or make it okay to make mistakes. So when we as leaders actually, lead by example, but go first in moments where it's like, who's going to take the first step, right? With implementation, especially, go first. Be the one falling on your face and learning from it and getting yourself back up, showing your team that this is how we learn. This is how we evolve. And also, like, don't be afraid to ask for help in moments of high stress. Don't be afraid to say, I need help, whether that's from a coach or from a teammate or, whatever the case may be.
Because especially in the clinical area, if you are unsure and you're guessing rather than asking for help, it really can go south really quickly. And by the way, your patients can smell it. They know. A mile away. They can smell it a mile away.
You see right through you. Those are the patients that are like, okay, I'll think about it. And then they leave and they never get that treatment done.
Absolutely. So to summarize what I just heard you say, I think what I would say is it's okay for leaders to fail forward. Because when you fail forward, what you're doing is you're going first. And if you don't succeed, what are the lessons to be learned so whoever is coming behind me can comfortably try it again, knowing that we're going to implement these things to make it easier so it wasn't as bad as when I did it. Yeah.
Exactly. And failure is part of a process.
Absolutely.
It is required. You know, we go to the gym, and when we want to work or grow a certain muscle,
yes,
we target it, we actually are putting that muscle under stress until the muscle is no longer stressed at that weight, and then we increase the stress. We add more weight. Yes. And we're actually supposed to work the muscle to the point of failure until it cannot do the thing anymore. And that is when the muscle grows.
Exactly.
So for some reason, we humans have turned failure into the enemy, when in fact, it is a requirement for our expansion.
Yes. John C. Maxwell, sometimes you win and sometimes you learn. So he takes out the word fail and replaces it with the word learn.
Yeah.
If things haven't gone the way you want them to, be able to pull back, dissect it, see what can be done differently the next time, and give your team the freedom to do the same. I love that.
Yeah. There's one more thing too. Mm-hmm. So this soft skill, grossly underestimated, acknowledgement.
Yes.
So along with going first, it's also being one who is always acknowledging people on purpose for specific things, not just good job, everyone, but like, Sally, thank you for the way that you talked to that patient. It was just so beautiful to see. It totally put that patient at ease. I'm so proud that you are my assistant. That kind of acknowledgement, especially in high stress, when people are like, nothing I'm doing is working, right? Because that's what happens, is we beat ourselves up a lot. When you as a leader can be the one to say, here are the ways in which you are great, here are the ways in which you are succeeding, goes such a long way. So
positive reinforcement.
Yes.
Really elevates us to progress. Yeah, I get that. Because when you're going through the hard and somebody's saying, yeah, this was difficult, but you know what? I appreciate the fact that you did X and Y and Z.
Yeah.
How you stop beating yourself up and saying, okay, all right, so how can I strategize to make it better? I love
totally. That. Yeah. And build it into your morning huddles. Make it a point to shout people out for the things they're doing well in your morning huddles.
Consistently.
Yeah. Consistently. Exactly.
So, Micky, how can a team leader make financial goals feel more meaningful and motivating for every team member, from the hygienist to the assistant?
So you have to speak their language. You have to know what matters to them. What's their currency? You know, there's like 4 sort of key personas. We talk about like Myers-Briggs and these personality tests. There's like 4 key personas. There's the competitives. Those are the ones that want to go for gold, A to B as quickly as possible. Like, tell me what to do and I'm doing it. Right? And they want to get there fast. That's the competitives, right? Then we've got the humanists.
Yes.
I'm here to help people. It's for the greater good. I often don't want to think of myself. I think of my loved ones and the people I take care of, right? A lot of people in healthcare tend to be humanists. And by the way, we're always some combination of all 4, but we have one that's strongest, right? Then there's the methodical. Those are the people that are very afraid of making mistakes. They get really in their head. They're the analysis paralysis people. They need all of the information in order to take action.
Yes.
Right? And then we've got the spontaneous types. These are the more social, extroverted people on your team. Sometimes they're labeled as chatty, right? But those are the ones that are often making the best connections with your patients, building those relationships. Right. And they're the ones that can diffuse some tension in your practice. They keep things more fun, right? Those tend to be the more fun, lighthearted people. Not that other people aren't fun. That's just a quality, like spontaneous people tend to put a lot of their, like they're incentivized by fun, right? I'm one of those people. I fall into that category.
No kidding.
Category. Very incentivized by fun, right? And I tell people my purpose is to be of service and to bring the party with me everywhere I go. It's like who I am, right? So understanding what personality type your team member is a good place to start, because you'll understand on a very sort of base level what drives them, right? If they're competitive, they like results. They're probably going to be incentivized by money. Okay. Your humanists, listen, everybody could use more money, but your humanists aren't going to say they want more money. They're going to say things like, I want to be able to spend more time with my family.
Right.
Or I want to be able to buy this thing for my child, right? Or take this trip. And so that's their currency, right? For methodicals, they may not be incentivized by anything other than doing a good job.
Right.
Right. And so finding out like what's their currency, what do they equate with good job could be important. This is also where love languages can play a part, right? And then for spontaneous, it's like they don't want to do it if it's not fun. Right. Now, not everything in a dental practice is fun, but we can make it fun. We can make a game around certain goals, right? So understanding your team's currency, their individual currency, will make a difference, because you could create an amazing bonus system or performance-based compensation system program for your team, or incentives, whatever. And not all of them are going to get lit up by that. They're going to get lit up by whatever their currency is. Right. So I say, if you're having a hard time getting your team to like be incentivized to reach financial goals, get connected to what really matters to them. What's their currency? And then speak to it that way.
I am absolutely a fan of that. And I'll tell you why. We are not all clones, as you've said, Micky, and understanding individuals and where their strengths are, where they glow, where they shine, what motivates them is so important in being able to action people to do things in a way that they are self-motivated.
Yeah, and I talk a lot about making each team member the CEO of their corner of the practice.
Yes. And you know what I would layer on that? Understanding what your strengths are. So, Gallup has a Strength Finders assessment that allows you to know what top strengths are, and layering that on top of understanding your temperance really helps whoever is leading to be able to say, oh, Micky's slightly pink. No, actually she's fuchsia. HD is more a light blue. James is definitely a sharp purple. And understanding how people show up. Okay, so that hot pink or that fuchsia, let's put her at the front desk. And also, let's put James there as well, because he's more methodical. So we have both. And there's somebody who is well organized and structured besides somebody who is a people person, right?
Yeah.
Because taking Micky, who is all of that and all of that fun stuff, and putting her in the back to do inventory would just dim her light, put her out in a heartbeat. Even though she may have the skill set to do that.
Exactly.
Understanding people is so important in determining how well your leadership goes. Yeah, love that. Love that. Okay, now, as we end our conversation, what is it that a leader can do to make decisions quickly while still making sure that the team feels heard and supported?
Yeah.
Sometimes it feels like you're going in opposite directions at the same time, and boy, that can be a doozy.
Yeah, it's quite the line we have to walk. when we are business leaders, business owners, or just leaders, right? Even an office manager can deal with this.
Yeah.
So I talk about the dentist in an office as having like 5 primary jobs.
Okay.
When the practice doors are open,
Yes.
Spire and Influence and practice dentistry chairside. Those are the 2 things while we are seeing patients. When there are no patients in the office and we're working on the business, vision, culture, solvency. So as the dentist, as the CEO of your practice, if you need to make decisions about the business, those are decisions for you to make, maybe with some input from your office manager or your spouse or your financial advisor, etc. But those decisions are not really open to input from your team. Those are business decisions. Okay. Now, when there are decisions to be made around implementing a new tool or strategy in the office, or introducing a new piece of equipment that might help your team, that's where you're going to want input from your team. But here's the thing. So many dentists and business owners, they're humanists, right? They want to do right by others. They have the best intentions, but they end up sort of giving their power away to their team. And then they're kind of jerked around by what their team is wanting and saying, except that for the most part, the team isn't connected to the business outcomes the way that you are as a business owner. So you have to know, you have to temper, when are you going to ask for input, fully understanding that your team only has the view they have about your business, right? And it's not their job really to have the full scope view of the business, right? That's your job as the business owner. So don't expect them to help you make decisions that they don't have the full view for.
Right.
They can help you make decisions around the things they do have view of, right? Mm-hmm. So I think the biggest mistake that dentists make is they give their power over, or they let the team jerk them around versus saying like, no, this is the vision. This is what's happening next. Now, we have a choice. We could do it this way or this way, but we're going to get there either way. So which do you choose? Right? You have to lead with conviction. You have to be able to communicate what the intended outcome is and have them support in deciding the pathway, but not if the outcome should be an outcome in the first place.
Right. So you know what? We're going right back to that thing where we say that clarity is key. Mm-hmm. As the leader, you have to have a clear mission and vision, mm-hmm. and have some ideas specifically about the goals that you want to achieve and how you want to achieve them. Because, you know, the feel is different in different offices. As you say, some leaders may be like you, fun-loving, and the environment exudes that, and the culture exudes that, and that's great. Others are more professional. They're more stable. They're going to be polite, but it's not the same as a fun-loving. Yeah. So I think leaders really need to be able to get some guidance as to who they are, what they want, how they want to show up, so that they can provide clarity for the team. And there can be input as to how things are going to go, but you must be clear as to the boundaries. I think that's what I hear you saying. And
it can be very unsettling as a team member to feel like your doctor is asking for your input because they they're relying on you and your input, right? And your team can sense that. So when your team starts to feel like, oh, doctor's actually deferring to us, like, does doctor know what they want? Right? That can also create a kind of tension where your team doesn't necessarily feel like they can trust you, or that's when you might start to feel like your team doesn't respect you as much because they can sense that you are deferring your power and your leadership. And sometimes it happens with office managers where the doctor defers all power of decision making to the office manager. And then the doctor, and I'm sorry for saying it this way, becomes like a doormat and just does whatever the office manager says. Now, there are contexts in which that's great to follow your office manager's lead. And there are other contexts in which you are completely undermining your power as a business owner to do that.
And what I would add to that is sometimes you are inadvertently creating distance, which makes you seem aloof and disconnected, not concerned at all with what's happening, because all you want to do is the technical dentistry stuff, pack your bag up, head out the door. And as a practice owner, you are so much more of that is required of you. You know, Micky, this is why we come back to the importance of having somebody to guide you, somebody to give you vision, not your vision, but show you how to have a vision.
Yeah.
And I could not have done it had I not had coaches along the way. And I see the value of coaching as I, like you, pour into dentists, physicians who recognize that there's so much value in gaining consistency and clarity.
Yeah.
So, Micky, if people wanted to find you, how could they, what would they have to do? Are you on the socials?
Oh, yes.
Give me some details, because
yes.
I know after this conversation,
yes,
that lady with that beautiful set of eyeglasses working.
Yes, so I'm definitely on the socials. You can find me on Instagram, Micky Chorny _. You'll see me pop right up. I'm also on Facebook as Michal Chorny, Michal Chorny. That's my legal name on Facebook. And I've got Align Dental Consulting also on Facebook as a page. But if you forget all of that, just go to aligneddentalpractice.com.
aligneddentalpractice.com.
Yep, exactly as you would spell it.
So, Micky, I have 3 hot topic questions for you. Are you ready?
I'm ready.
Tell me about this. Bucket list. Where would you like to go before you depart from this earth? What is the one
like travel
you have to visit? Yeah.
Ooh, there's so many. I will say Thailand's been up on that list for a bit now. So Thailand, Brazil for sure.
Ah, you're a carnival girl. I'm looking at all that color behind you.
Yeah, I do. I love Brazilian music, and I do feel like a connection a little bit to their culture. So I would say those are high on my list, but I have a whole list of places I want to see.
Okay.
Yeah.
Favorite movie of all times?
Oh my goodness. I don't think I have one. I think it really depends on the mood. And I'm not a watch movies more than once kind of gal, actually. But there is one movie that I have seen many, many times because when I was younger, it was always on TV, and that was Bring It On.
Oh.
A movie about the cheerleaders. I've seen that movie so many times. So, yeah.
Practice the moves?
Oh, no, but the music is definitely ingrained in my head.
Ingrained in your head. Okay. Favorite food?
Ooh, I love fresh pasta. I can never go wrong with a plate of fresh pasta. And then for me, dessert. Dessert is my favorite food group. Yes.
Oh boy. So listen, this has been such a fabulous connection. And I have one final question for you. Are you ready?
I am ready. Lay it on me.
Will you commit to coming back and sharing with us on another occasion?
Oh, it would be my absolute pleasure and honor. Absolutely. I will. Anytime you want me back, I'm happy to come back.
Okay. I have several witnesses.
Yes.
And viewing you. So we're holding you to it.
Yes.
It has been pleasure. So wonderful communicating, sharing. You know, we have so many similarities in the way we think, and iron sharpens iron, right? So
yes.
it's been so motivated by this conversation. It's more than I can put in words. And so I'm going to end this podcast by saying we always have to remember that consistency and clarity is key, according to Micky.
Yes.
I didn't plan to write that, but it rhymes. How about that?